Hey everybody, I'm Candace Hunter from the Practical Herbalist, and today we are talking a little bit about the respiratory tract. Really, we're focusing on the lower respiratory tract and flu and cold symptoms. We've already talked a bit about the upper respiratory tract, which pretty much encompasses the throat up. It includes the sinuses, the back of the throat, that sort of thing. The lower respiratory tract starts around the neck area and includes all of the lung system. Oftentimes, we kind of put the throat in both categories because the throat is affected by both the sinuses in the upper part of the body and by the lungs in the lower part of the body. The biggest difference in the way that I look at the upper and lower respiratory tract, and the biggest difference is, or the way that reason that I look at them differently, is that the upper respiratory tract is kind of like a pass-through system. Its job is to filter all of the air that comes into the lungs. The lungs are the destination. So the destination is where the air exchange, toxin exchange, waste exchange happens. And it's that difference in what their jobs are that's really why I separate the upper and the lower. The throat is it is partially passed through, but it's so strongly affected by what's happening in the lungs that I tend to group it with both the upper and the lower respiratory tract. So it's a little bit muddy, I suppose. But because the lungs are taking in and are the destination for the air or what's coming in through the respiratory system, they are receiving everything that comes in. If you're living in a perfect environment, you're absolutely healthy, and your air is really clean, then any particulates, like pollen, let's say, that might have been in the air will be filtered out by your nasal passages. The air will be warmed as it goes through your nasal passages and goes down the back of your throat, or down your throat into your trachea. And by the time it reaches your lungs, it should be feeling warm and pure and wonderful. And your lungs take that beautiful oxygenated air in, and they give back the carbon dioxide that is in your blood system, as well as other wastes that may have been in your blood system or in your system. And that goes out. Your lungs do a huge amount of work for eliminating toxins and waste from our systems. Lungs and the skin are like the two biggest areas where we eliminate toxins, even though most often when we talk about the human body, we think of other systems like the bladder and kidney system and the liver and the digestive system as being the primary waste eliminators. And while those are really important, we really often don't give the lungs the glory they deserve for how much they eliminate from our systems, how much support work they do for us. So in a less perfect world, what happens is that your sinuses work at removing everything they can, but sometimes germs can get through and they can get down into your system. Pollen, smoke, those can also get through. If you are in an area where there is smoke in the air, for instance, with wildfires that can happen, you're going to be breathing in smoke. If you are a smoker, someone who is purposefully putting smoke of any sort, that doesn't just mean tobacco smoke. It can also mean smoke from medicinal plants like cannabis, or other herbal plants like mullein, or coltsfoot. These are other plants that are often added in smoking blends. And some of them are less harmful to the lungs than others, but no matter what, they all have particulates. People use a lot of incense also, breathe in a lot of smoke and particulates. And if those aren't perfectly filtered out in your nasal passages, they will get down into your lungs. So all of that stuff aside, that's what the lungs do. That's what the lower respiratory tract is about: receiving oxygenated air, giving back or expelling the wastes of the body, including carbon dioxide. Now, when things go wrong and you have an illness that gets in, for the lungs, the primary symptoms you'll see will be a cough. Your lungs' first job is to make sure there's nothing stuck in them, because they are essential to life. This is another reason why I tend to think of the upper respiratory system as separate from the lower one. Not separate, but I address them differently. The upper respiratory system, if you get a stuffy, plugged up nose, it's going to be very uncomfortable and unpleasant. but it's not going to kill you. If you get lungs that are stuffy and plugged up, you could die. So it's not something to mess around with. Your lungs they have a wider range of symptoms. A little bit of a cough, just a little tiny cough, that's not going to likely kill you. You'll probably be okay. But you can get into areas, especially for people that suffer from conditions like asthma, where your lungs start to close up, where the coughing isn't productive and isn't opening it up. That gets very dangerous. So that's my second reason why I talk about and address the upper respiratory system separately from the lower respiratory system. They're very intimately connected. They're really the same system. But the severity of symptoms that you can deal with in the lungs is much bigger than the severity of symptoms that you are likely to deal with in the upper part. So I'm going to put the caution out there right now. If you're having problems breathing, don't use herbs. Go to the doctor, go to the emergency room, seek medical professional advice and help. Don't mess with that. Herbs can help you in many things and in many ways, but when you start getting into the area of having a hard time breathing, you're in some really dangerous territory. That can turn into various serious problems as well as death really fast. Don't go there. The other caution that I have for you is that pain and, hard time breathing can be a sign of things that are not cold and flu related. For instance, if you are feeling pain in your chest, if you are feeling like your lungs and your chest are being compressed, that could potentially be a sign of circulatory problems or heart attack. See a doctor. See an emergency room. Seek help. If you are having pain that's getting worse, like sore throat is common with coughs as well as upper respiratory stuff. If you have the mucus running down the back of your throat and it's starting to collect in your chest and you're coughing it up, all of that's going to aggravate your throat. It's going to make it hurt. If you start taking the herbs and you notice the respiratory, the mucus is getting lessened, that's good, right? You're feeling better. The cough is getting less. That's good. But the throat soreness is getting worse. That's a sign that you should go seek some medical advice. If the pain gets worse rather than better, even if other symptoms are getting better, seek help. Depending on how hard you're coughing and what the cough is like, some people will experience pain in their chest that is muscular in nature. I've known folks who've broken their ribs coughing. If you break your ribs, you're going to need medical help. You're probably going to want to see a doctor. If the coughs are getting so bad that they're causing serious pain in your chest, it might be a wise choice to go see a doctor at that point too. So pain is really letting you know that there's something wrong, there's a problem, and you watch the level of pain to see, is it getting worse or is it getting better? If it's getting better, okay, you might be on the right track. Good. If it's getting worse, it might be time to go. It might be a red flag, essentially. And then, like I said, certain types of pain, like crushing pain in the chest, is a very bad sign. If you're starting to get severe headaches along with your coughing, that's also a bad sign. So you want to go in and see a doctor in those cases. So cough, we're going to talk about that briefly here, is the biggest thing you're looking at. Is the cough damp or dry? Is my first question. A damp cough has phlegm. You're coughing stuff up. It's moist. It's, there's stuff. Or you feel like stuff is stuck in there. Maybe you're not able to cough it up. That would be an unproductive cough, as opposed to the cough where you're producing stuff and you're coughing the mucus up and out. What the lungs are trying to do is, they've seen the invaders, they've seen what it is they don't want in there, and they're trying to coat it in mucus and remove it up and out, cough it out, to expel it. Your lungs aren't taking the time to figure out what that is that you're getting rid of, but they're going to act fast. So you're going to end up potentially with a damp cough. If you have a dry cough, that's the coughs that are irritable and they don't have any phlegm or any mucus associated with them. In fact, you might be feeling like you wish there was something there because they're not doing a lot. Dry coughs can happen for a variety of reasons. Some of those reasons include there's something stopping your body from being able to make enough mucus. Maybe you're dehydrated, or maybe there's something else, another different systemic imbalance happening that's causing you to be unable to make the mucus that you need to expel whatever's there. They can also happen when there's damage to the lung tissues. So if you've been ill with a cough and maybe it was productive for a while, maybe it did or didn't get unproductive, but the primary symptoms have cleared and there's still this lingering ticklish cough. That can happen when you have damage to your lungs. It's usually minor, but it could be major, but it's often minor damage, but can create a cough that doesn't go away. And then by continuing to cough, when it's like that, you're actually continuing to stress the tissues that are trying to heal, but they're not quite able to do it. So it's similar to like when you've got a cut that's scabbed over, and then you get that itchy point where you know you shouldn't scratch it, but because it's almost healed, but it isn't quite healed all the way. And if you scratch it such that you take the scab off of it, you kind of reopen the wound. That's kind of what's happening. That could be what's happening with a dry cough. Like I said, there's a variety of other reasons why you can end up with a dry cough. So damp or dry is the first question when you're figuring out which herbs you want to use. Hot or cold is the second question. And at least with a damp cough, you can see whether it's hot or cold by looking at the color of the mucus that's coming out. If it's white or clear in color, then that indicates more of a cold, which means you may want to warm up your lungs and use warming herbs. If you're seeing yellow or green or similar yellow-greenish colors, then that indicates a hot cold, which may mean more of an active virus, something that your body isn't quite able to be kicking at or is having more struggle with. So you'll want to look for cooling herbs, but you might be also wanting to look for a little bit extra boost in antimicrobial types of herbs, because you may have an infection that's starting to set in there. Maybe you started off with simple allergies and it's turned itself into opening the door to virus or bacterial infection, or who knows. I mean, it's a very complicated system, even though it looks pretty simple, right? If you notice pink, red, or flecks of pink and red, that could be an indication of a bigger problem. Watch that. If you notice that stuff going through your upper respiratory system, at least when I do, I typically watch it and keep an eye on it, but I don't run to the doctor unless it starts to get worse, or I notice a great deal of pain involved, or there's like high fever and other types of symptoms along with it that make me worried. But with the lungs, having any blood or any pink or red coming out of the lungs as part of the mucus, that could indicate a much bigger problem. So that might be a point where you want to go to the doctor. Again, it's the kind of thing that you want to keep an eye on, know your body, know yourself, and know how you typically see your body, or the body of the person that you're working with, how they typically respond to coughs, colds, and flus, that sort of thing. So you've got an idea of whether you've got hopefully a hot or a cold cough or symptoms. And you can also look at secondary symptoms. Is there a fever associated with it? Are you finding that has the cough moved to a point where you can't get the mucus moving? A lot of times mucus gets stuck and solidifies a bit, or starts to get sticky when it loses its dampness and when it cools, where the body doesn't have the energy it needs to push it out. So if a cough has been unproductive for a while, you can end up with, it can be a cold situation where you need to give it a little bit more oomph or energy to help get things moving. Let's see, and lax or tense. So when you have a cough that's too shallow to be effective, it's not really doing anything, that indicates or suggests more of lax or relaxed tissues. Your body doesn't have the energy, your muscles aren't having the energy to give the cough to cough out or expel what you need to. On the other hand, you can have, especially when you have racking, hacking cough, you can have musculature that's so tense it doesn't really let go in between, which can also cause an unproductive cough because the muscles are tensely hanging on with each cough. you can't really get the deep breath in that you need to force it out. And then even when you do get the coughing to subside, the musculature doesn't let go. So that's an area or time when you have more tension. Lax versus tense, relaxed versus tense is the last piece that I look at. And sometimes I just ignore it because it can be complicated and challenging to recognize the difference. But it can be helpful potentially when you're looking at herbs. So let's roll through some herbs here. There are a whole lot of herbs that are really helpful for coughing, and I'm just going to talk about a few of them. There's more that you can take a look at the article on this site, and I'm going to include in this article for this video, there will be the links to the Herbs and Actions Summit, COVID and Beyond. Maria Noel Groves gave a wonderful discussion of so many herbs that are really helpful for the lungs. And then Phyllis Delight talked a lot about helping with recovery. So some of the herbs that I really love for coughs in particular is mullein and yerba santa. I like those for moistening up the system and helping open the lungs and bring antimicrobial energy into the lungs. So killing the crud off. Mullein is particularly moistening and mucilaginous. Plantain's another really good one for mucilaginous or moist condition, or for creating moisture. And then licorice root is one of my three favorites for creating moisture in the lungs and the system. I personally love lobelia when I have anything lung related, regardless of whether it's warm or whatever the picture is. I'll often use lobelia, but I don't necessarily use a lot. I'll use that as my activator to kind of direct the formula toward the lungs. I really like that. It's antispasmodic and it helps to open the bronchial airways. And it does have a particular affinity for the lungs. So that's why I like to use it there. I like Jamaican dogwood and cramp bark for helping to reduce spasms, which they're together, they work well as antispasmodic, so it reduces the muscles wanting to cough, but they both help with reducing pain as well. So Jamaican dogwood I think of as being more analgesic than antispasmodic, and cramp bark I think of as more antispasmodic than analgesic, but I like them both together. And then yarrow is another one that I will often use when there's any kind of cold or flu symptoms, including lower respiratory tract symptoms, because yarrow is astringent, so it dries things up, tightens the tissues a little bit so they're not saggy and soppy. And then it also helps to drive stuff out. So it'll open up the airways and air passages and help to drive the germs or whatever they are out. Oregon graperoot's a really good antimicrobial for these kinds of situations for the lungs. Cayenne and ginger are also very warming for the lungs, and they're good at driving out crud and germs. So that is my super fast. Oh, and elecampane. That was my last one that I wanted to mention. Elecampane is good for sore throat stuff. It's good for lungs and chest stuff. I have a tendency, I'll admit, to just sort of throwing it into anything for the respiratory tract, even if my primary symptoms are in the upper respiratory tract, because while its affinity might be more for the lungs, it really does a wonderful job with the throat. And for the most part, I've found that the throat is almost always made sore by anything happening in the upper respiratory tract as well as anything happening in the lower respiratory tract. So for me, elecampane is one that I almost always rely on. So I suggest you pick your herbs based on your symptoms and what you're seeing. I like to keep it simple. 3 to 5 herbs is what I work with for the most part. And I know that I'm going to vary them. If the cold was really mucousy and really productive and the problem was it was just too much, then, and there might have been pain or soreness, I might have a formula for that. And then as the cold progresses, the body gets a little bit more tired and worn out. Maybe it becomes less productive. I might swap out the original cough piece that I had of that formula and from one that's you know, helping to reduce the mucus to one that kind of moistens a little bit extra. And I might add in something that instead of the antispasmodic, I might switch that out for an herb like reishi that helps to, or tulsi that helps give a little bit of energy to the body so the body can get through it, or ginger also is a bit of an energizing herb. So, you know, it all depends each day, or, you know, hour to hour, morning to night. I kind of watch the symptoms and I change them up. That's why I suggest a simple formula, because it makes it a lot easier to adjust. Oftentimes I will use a pre-made formula like a white tiger balm or a chest rub. When I was a kid, it was a Vicks Vapor rub, although I don't like that one as much now because it's a very petroleum-based rub. We have a really terrific recipe for a do-it-yourself one that you can make at home. I keep that balm around all the time because I'll use that one as my antimicrobial immediate open the lungs up formula, and then I'll look and make the custom formula that I'll then use as maybe an herbal decoction, or I might turn it into a quick syrup. I like, for the lower respiratory tract, I like herbal infusions and decoctions. I like steams a lot. Compresses as well, although I tend to use those more for upper respiratory, but they can be really helpful on the chest, particularly like a good garlic compress if you know it's a bacterial infection. That can work really lovely. I already mentioned the balms and chest rubs. Herbal syrups, herbal honeys, and tincture blends are also two that I particularly like. Both of those I especially like during the recovery phase because it makes continuing to take the medicine much easier. So there you have it. There's a whole lot of ways that you can use the formula you've created. Keep it simple, adjust it as you go. And again, if you have any problems breathing, if you have any concerns at all, see a medical professional. Good luck. I hope you don't need to use any of this information, but if you do, I hope it serves you well. There you go.